Well, throughout the project there was a real catch-22 between when we would engage with disabled people and then actually determine what the user-led organisation itself should do.
The Cambs ULO is the product of a paradox. On the one hand, and all credit to the Department of Health for running the programme, on the one hand there's been this political drive to empower and build the capacity of user-led organisations on the ground, and at a critical political time. On the other, in Cambridge's case, there hasn't been a user-led organisation robust enough to respond to that opportunity. So we've been in a situation as providers and passionate advocates for a user-led organisation to be trying to set up one where we're not all users ourselves, nor have we had the mandate from the thousands and thousands of disabled people within Cambridgeshire to decide what we should be doing and how we should be doing it.
There was clearly a tension between, well, actually can we do that, or no, we haven't got that mandate, we haven't got that right, we need to go back out to grassroots disabled people and ask them what they want. And we did that to a certain extent with the consultation document. We went out and we consulted. But we were very clear that that consultation was to inform the ongoing business of the ULO and not to go back and say, what do you want from the ULO? Because if you were giant blogs from either Cambridge or the rural areas of Cambridgeshire, I don't think you'd give a monkey's whether or not the ULO was a CIC, limited by guarantee, or a charity. Actually what you care about is what it was going to do and how it was going to positively impact on your life. So we thought if we kind of got a sense of what it was that they wanted that would make a positive impact on their life, we could as a steering group then work out the governance structures and the leadership and transition board that would then deliver it.
At the engagement and involvement events, there were some things that could have worked better. For instance, we didn't set booking deadlines for the events, and what that meant is that some events were over-attended, some were, quite, had low attendance, and that just made it quite difficult in terms of managing it and knowing what to expect. And just something very simple like a booking form and a booking deadline would have been great. The other thing was around when we were promoting the engagement and involvement exercise. We did that in various ways. It was primarily word of mouth through organisations and cascading information by email, having flyers at events, etc. But we also used adverts in local papers. And one of the things we found was that you couldn't always control what went into those papers, or for instance, the font size of an advert, might be inappropriate, and so there were some things around trying to be mindful of accessibility when you're promoting an event as well. The other thing that we'd probably strongly recommend is booking up advocates, BSL interpreters, and facilitators well in advance of events, and having dates for your events planned well in advance. Because you can always cancel them if needs be, but what it means is that you can absolutely make sure that you'll meet the needs of anybody that comes along.
If there's one piece of advice that I'd give someone who's running an extensive engagement and involvement exercise, again, I think it would be something to do with resource. So the budget that we attached to it and the time that we attached to it was about 25% of the whole project for that intensive sort of 8-week period. And that was incredibly important because we were able to overcome some of the traditional barriers that people might face by being able to pay for travel and attendance fees and what have you. But it also meant that we could promote the engagement exercise widely, we could come up with all the materials that we needed. So I overspent in that area and I'm very pleased that I did, and I would do it again. We had lots of results that came out of the engagement involvement exercise and having sort of focused on 4 particular areas. And what we've been able to do is use some of the findings to actually inform what the concrete business plan of the user-led organisation looks like. So one good example is around peer support for direct payment users. we were roughly aware of the need for that support within Cambridgeshire early on in the project, but we were actually able to evidence what that need was. So that came out, and that's formed directly the business plan of the youth-led organisation. So
I don't for one moment think we've got it 100% right, nor that the process is complete. There's a lot of work still to be done. But what there is now that there wasn't before is a user-led organisation with the backing of a number of really key providers in the organisation, in the county, who really want this to happen, and an absolute commitment to ensure that it is member-run as soon as possible, and that it's making a real difference on the ground for people who are going to benefit from self-directed support and other services in the county.